students, today we are dealing with one important concept in the treatment approaches. We all know that there are different approaches in dealing with psychological disorders. There can be individual therapies, there can be group therapies, there are eclectic approaches and also integrative approaches. So, today we are focusing on group approaches or call it as group psychotherapy. Whether it is group psychotherapy or individual psychotherapy, the aim of the therapy is to help the client in dealing with the difficulties and make them cope with the situations effectively. The only difference in the individual therapy and group therapy is, in individual therapy, the client meets only one therapist and it is a one-to-one interaction, whereas in group psychotherapy, the client meets with various other members of the group, and in this approach there may be more than one therapist. The aim of group psychotherapy is to help the client in dealing with the emotional difficulties, in enabling them to overcome these difficulties and eventually leading to the personal development of the client. In this group therapy, the therapist is called as a conductor, facilitator or an educator. He chooses those individuals as participants whom he feels that they would benefit from this kind of a group therapy and who can provide or who can create an impact on the other members of the group. Once we have understood what is the concept of group psychotherapy, the effectiveness of any group therapy depends upon the way it is functioning. It depends upon how the group is functioning. So, let us see how the group psychotherapy functions. What are the rules and regulations involved in this? What is the responsibility of the participants? In this group approach, members of the group share their personal issues which they are facing with the group. The participants can talk about the events which they have witnessed during the week, their reactions to the events, how they have dealt and various other aspects. The participants can also share their inner feelings during the previous sessions. They can relate the issues raised by the others and also they can react to the words of the therapist. Sometimes when the members are interacting with the group, the other participants in the group may give feedback, may provide support and sometimes also give effective criticism or constructive criticism in order to make the member understand or realize his inner feelings or the way he was committing mistakes in dealing with the life situations. The subjects for the discussion in the group therapy are not determined by the group leader or call it as group therapist, but the topics are taken spontaneously as decided by the members of the group. When the members are interacting with the other members, they try to realize that the problem which they are suffering, it is not their own problem or it is not all alone they are suffering with this, but there are various other people who are having the similar problem and experiencing the similar feelings or thoughts. When they are sharing their intimate feelings, their inner feelings, which was creating a large impact on their personality, naturally the other members come to their rescue by providing the moral support. Especially when they are experiencing the intense stress, the group members act as a stress buffers. Not only that, even the feedback which they get from the members of the group provides them a kind of a support in understanding what are their maladaptive behaviors, how they can rectify their behaviors, what is that they have to change, are they ready to change, and then try to come out with constructive solutions or reactions. Group therapy not only helps the participants share their feelings, but it also becomes a lab for them to try new behaviors. Once the participants understand that there is some problem in the expression of their feelings or in their thought process or in their behavior, and when the members give the feedback and when the therapist tries to give them the guidance, they try to experiment with these new behaviors before they try to act out in the real life situations. Sometimes when they are trying to interact with the other members who are having different personality traits, some of them may represent few people whom they have seen in the past, whom they have experienced similar personality traits in the past or in the present life, and this helps them to understand how to deal with these people with different personality traits or with different temperaments. Group therapy gives them an opportunity to work through these situations. How effectively the group functions depends upon the participant's role. The role of the participant is very vital for the group therapy to be effective. In the group approach, the participant is expected to be on time and he has to come every week for the prescribed number of sessions. Not only the information shared by the other members, but the names of the participants also have to be kept confidential by the members of the group. In some groups, the members are asked to commit at the beginning of the therapy itself to commit for a specified length of the time. The session may last for about 3 to 4 sessions or it could be more than that, but the individual is given the information about the number of sessions and the commitment from the participant is elicited at the beginning of the approach itself. Generally, the usual commitment in most of the group approaches is 3 to 6 months. This helps them to get a sense of what is happening in the group, what is that is expected from the participant and how it would be useful to them. When we expect the participants to share their personal information or the difficulties or the stress levels, it is not a compulsion that each and every member has to do that. It all depends upon their interest and the participation level. No one is compelled to express their inner feelings, share their difficulties, but it is out of their interest. They can come out with their emotional turmoils and other members try to give them the social support and the moral support. How the group is constructed? When we are saying like group therapy and when we are interacting with more number of clients or say participants, naturally the construction of the group therapy varies from one group to the other. Therapy groups may be homogeneous or heterogeneous. Homogeneous group may have the members with similar diagnostic background. For example, people who are suffering from depression, all of them may form a group or may register for the group therapy in overcoming the depression. The members who are suffering from the depression levels wants to deal with this, wants to combat with the depression, and so they form a group as a treatment approach. On the other hand, heterogeneous groups may have participants with different backgrounds. They may suffer with different psychological problems. They need not have the same common problem. However, whether it is homogeneous or heterogeneous, the number of clients generally confined to 5 to 12 members. Because the research and the clinicians agreed that group therapy can be more effective in certain cases with some clients compared to the individual psychotherapies, there are different ways of conducting this group therapy and there are various groups which are formed for a particular purpose of helping these clients suffering with various psychological turmoils. So, one particular psychotherapeutic group is supportive group. In this approach or in this group, the therapist ensures that the participants' experiences are used only positively. Whatever experiences, whether it is pleasant or unpleasant, shared by the members are not used or are not commented upon, but their experiences are discussed upon in a positive light, so that even the other members of the group will be benefited by the experiences of the others. In the supportive groups, they also see that the relationship between the members is very cordial, but at the same time they also see that the relationship is not becoming intense. In these supportive groups, the therapist takes care that the very vulnerable clients will not become the victims when they have to share their experiences or when they have to receive the criticism from the others. Proper support and security will be given by the therapist. In this way, each member gets the support from the members of the group. At the same time, they offer support to the other group members. The other type of psychotherapeutic group is self-groups. These groups are generally organized and led by patients or ex-patients who have identified their maladaptive behavior patterns, who have identified their feelings and thought processes, and who have learned a better way of dealing with their situations. These people, they might have suffered earlier from any kind of a substance abuse or any kind of a mental illness like depression or suicidal tendencies, but how effectively they could combat those tendencies and how normally they are able to adjust to the present life situations. The experience of these participants will also help the other participants when they listen to their experiences, when they listen to their feelings, when they listen to their strategies which have been proved very productive. Once they listen to the other members of the self-help groups who could come out of their psychological turmoil successfully, these people also raise the doubts regarding various issues as to how they could deal with certain anxieties, certain insecurities, and also the environment around them. Certain examples of self-help group include Alcoholic Anonymous organizations, groups of parents with mentally handicapped children, groups of parents who are having autistic children. So, there are various other self-help groups depending upon the nature of the problem that is experienced. The other therapeutic group approach is medication groups. Medication groups have been used for the treatment of recurrent depression and bipolar disorders. In these groups, the emphasis is on compliance with prescribed medication. Generally, most of the participants who have to take the medication for their illnesses, they deny to take the medication. They are not ready to comply with the prescribed medication. So, when they are made a part of this group, they are able to understand the need of it and they try to follow the instructions given by the doctors or the nurses in a more effective way compared to earlier way of dealing with the situation. The goals of medication groups include increasing the patient's knowledge about their illness, increasing compliance to the medication, educating them about their illness, decreasing their isolation, and helping them to deal with the health and mental illnesses more effectively. They try to accept the environment in a more non-judgmental way. The next therapeutic group is interpersonal group therapy. This approach was developed from the research work done by Yalom. In this particular group, the treatment focuses more on dealing with the interpersonal relationships. When people come for various psychological issues, in most of the issues it is found interpersonal relationships is hampered a lot, and this may be the cause in certain cases or this may be the result in some other cases. So, the emphasis is on improving the interpersonal relationships. In this group, the past of the client is discussed only to understand what were the earlier experiences of the client, how he handled it, what was the result of his particular strategy, where the problem was. Once we understand this, then in this particular group, they try to make them understand the need to learn the new ways of dealing with the relationships. They try to make them understand the importance of learning interpersonal skills. So, this importance on interpersonal skills or interpersonal relationships is the thrust of this particular group. Though these are basic types of therapeutic groups, there are some other therapeutic groups like encounter groups. When you hear the term encounter, the name itself indicates it is more intense. So, very few people are really interested or can handle the interactions in the encounter group. Every member cannot be very successful in participating in the encounter groups or may not be feeling comfortable in participating in the encounter groups. The reason is, in these encounter groups, the interactions are more intense and they are very rapid, with the hope that there would be immediate change because of these kind of intense interactions. The encounter can be entirely verbal and it is more in a challenging form, or sometimes it can be physical, like hugging, touching, which is encouraged among the participants. Sometimes the experience is further prolonged by continuing the therapeutic process for about a week or for more than a day. But the problem is, this particular way of dealing with the participants is not suitable for everyone. We have to identify who can be comfortable participating in the encounter groups. This particular encounter group is especially not suitable for the people possessing the emotional problems. The next therapeutic approach is psychodrama. In psychodrama, the group enacts certain events from one person's life. That is, whoever is willing to share some of the experiences, and if he is giving the consent to enact those events, the group members take up the roles from those particular events and they try to enact. Most of these scenes will be related to the family issues or other interpersonal issues related to the workplace or with the friends and colleagues. When they are enacting these roles, these feelings represent the emotional state of the person and they try to find out how he was handling the situation, how he was reacting to the situation, and the other members give their feedback whether there is any other way of dealing with the situation rather than using the same approach as shown by the experienced member. Sometimes in psychodrama, we can also take up certain other events which are not related to any one particular member's experiences. They can take up any common issue which everyone experiences in some form or the other in their life, and they can enact that. For example, authority. If you take the authority, how to deal with a boss or how to deal with a superior, this might be a common problem to most of the members of the group. So, they can enact certain situations related to this authority as to how they can handle the relationship with the boss or with the superior person. This method is called sociodrama because we are taking up the events from the social life which are common to the people. The other therapeutic approach is inpatient group psychotherapy. This inpatient group psychotherapy, as the name indicates, is formed in the hospitals with the inpatients. When psychological treatment is given to the inpatients who are hospitalized, apart from the medication, they also feel that there is need to make them come as a group and then try to learn certain skills in accepting the real life situations and also making them deal with the present situations more effectively. The goal of such inpatient group therapies are to create awareness about their illnesses, to make them understand about the intensity of the illness that they are experiencing. They also interact with other group members who already recovered from the similar problem or who are experiencing the same kind of a disease, whether it is physical or mental, and this helps them to get the feedback from the other people, that is other inpatients, which make them understand and learn better coping strategies in accepting these situations. This helps them to overcome the isolation and also try to lift their well-being. Lasel is the person who is credited with the development of this inpatient group therapy. Though the group psychotherapy is very effective and all the members are very cooperative in making the group therapy success, there may be certain dropouts from the group therapy. As we discussed, in some of the groups, most of the participants may not feel comfortable, like in encounter groups or in psychodrama. If we leave those groups aside, even participating in the other normal therapeutic groups, some people hesitate. Even if they try to continue, they try to focus on a particular time where they can just see the situation as an excuse and then they try to drop out. So, sometimes the dropout rate from the group therapy is also high. Individuals who are emotionally fragile, who are unable to tolerate aggressive and harsh comments from the other members of the group are very vulnerable in continuing in this group. So, they are the people who are at risk of dropout. Similarly, those people who have a trouble in communication are also ready to drop out any moment once they realize that they cannot face the group or they cannot share their feelings, or when they feel like their inner feelings are touched upon. So, the group therapist and the other members have to identify their feelings, reduce their feelings of stress and tension which they are experiencing, and make them feel that they are the part of the group, so that the feelings of isolation will be removed from these people who are very vulnerable. Another important factor is the moment they drop out from these group therapies, these persons feel or these members feel that they are once again a failure. So, in order to make them come out of that feeling, we have to identify in the process itself whether they are able to continue in the group process, whether they are having any difficulty, and once we identify that, immediately we need to give some kind of a moral strength and moral support. The group can be injured by the premature dropout of its members. So, it is the responsibility of the group therapist to see that the group process is functioning in an effective way, group processes are taking place in an effective way, and also that the members are trying to follow their rules and regulations as per the instructions given at the beginning of the therapy itself. Termination. Any therapy will be terminated after a limited number of sessions, and group therapy is also not an exception. Different groups try to terminate themselves in different ways. For example, if we take drug de-addiction centers and some other rehabilitation programs, the groups themselves will not terminate, only the members will be moving in and moving out as per their treatment focus upon, sometimes as per their treatment. Sometimes people have left the group either after the completion of the treatment or even before the treatment. Once again they may come back when they feel the need of it. Whereas, in some other groups, once the group is terminated, they have to face the real life situations based upon their coping skills that they have learnt in the group process. Some other groups, at the beginning of the formation of the group itself, will set the end date as to when it will come to an end, after how many sessions or after the prescribed number of goals. Some other groups may continue to interact until the therapist and the other members feel that they have reached the goal, or they may continue once they feel that there is a need to have some more sessions. So, when a particular group terminates depends upon group to group and also depends upon their goals. However, termination is not so easy, because members develop a sense of support, a feeling of bondedness. The termination may create some kind of an emotional turmoil, as many people suffer from feelings of anger, grief, abandonment and rejection. It is the responsibility of the therapist to identify process itself who will be very vulnerable at the end of the termination, and he has to see that they try to accept the termination in a more normal way rather than experiencing these kind of intense emotional feelings. This is the time, that is, when the group comes to a termination, the therapist can check whether the group members are accepting the termination in a very natural way, using their coping strategies, whatever they have learned in the group process, or whether they have failed in implementing these techniques. Working through this termination is an important part of the treatment process. So, if the members are failing to terminate the group in a more effective way, naturally the functioning of the group approach is also questionable sometimes. There are also certain limitations for the group therapy. It is not suitable for those people who are suffering with depression or who are at a risk of suicide. Similarly, manic patients have a difficulty in continuing in the group therapy. The reason is they have high feelings of elation, excitement, high irritability, and it is difficult to manage these people. Similarly, patients with subnormal intelligence may not benefit from this kind of a group psychotherapy. To conclude, group therapy was proved very effective in dealing with various psychological issues. Compared to the individual psychotherapy, it was found that clients will benefit more from the group therapy as they see similar people experiencing similar problems like them. However, the effectiveness of group therapy depends upon the way the group is functioning, the role of the participants, and also effectiveness of the therapist. Each participant has to follow certain norms and regulations. Whatever information has been given to them,